Yes, my name's Amy. I'm a harm reduction worker at SDAS, and part of my role is liaising with the hospital. I come in once a week, do some work with the alcohol care team. We make sure that all clients have that open communication with us whilst they're in Musgrove, and getting sort of any messages passed back to key workers too, to make sure that we can keep that communication. We also run group work. I run the alcohol resolution clinic every week, which is a really nice chance to get people together, talk about shared goals and give hints and tricks really on how they can help themselves. As a harm reduction worker, we get lots of different substances. I mainly specialise in cannabis, cocaine, alcohol, ketamine. We do see some other substance, any substance can come through our door. It just depends what team you'll go under once you come through assessment stage. So one part of my role is being the hospital liaison worker, and to do with that, we link in with the alcohol care team at Musgrove. So I have regular contact with them. We call them daily just to see if any new clients have gone into Musgrove, any new referrals that might have been submitted that we can pick up our end. And they also let us know if any of our clients have gone into Musgrove, and I can get the updates, see how they're doing, make sure that their scripts are still going in whilst they're in Musgrove. When they're going to be discharged, we'll make sure we get the paperwork to get their scripts continued in the community again. It's quite a good chance too to be able to link in with our clients, give them that harm reduction advice, do some relapse prevention work with them whilst they're in Musgrove, and then hopefully get them ready to be discharged.
So we tend to see people at the front door. They tend to come through A&E. That's the first point of contact. We meet them there to ensure that they know that they're supported throughout their journey here. We make sure that we put in any medication that needs to help with symptoms of withdrawal. We ensure that any OST medication is prescribed. We manage alcohol withdrawals with medication just to make sure that they're comfortable and that we can deal with any other issues that they're presenting to hospital with. And so we work with lots of other services in the community. We work with SDAS, and we also work with a lot of mental health services, in particular dual diagnosis. It's very important that we recognise that substance use and mental health can sometimes come hand in hand, and it's really important that we pay close attention to that.
One of the support we offer a stigma-free approach, and then we have a conversation with the patient. Myself, I complete an assessment on the patient and have a conversation in regards to their history of drinking, how much their pattern, and if there are any other substance use, as we are evolving towards substance use also as a team. So what we do is signpost them to services in the community, help them through their journey into the hospital, and depending on their needs of support, we explain them how our counterparts in the community like SDAS work, and the services, how they can approach that. We complete a referral for them, and we give them advice on relapsing or returning to drinking. We don't use relapse anymore. We give advice on how to manage their cravings. And as I said, we signpost to our colleagues into SDAS, dual diagnosis, mental health if it needs be, if they come with any mental health problems. And we support them like that because we want to be the first face that patient sees. For example, people don't know, they know about this, but not too many. It's timing. It's a medication that's being given in the emergency department on the ward as the patient comes in. Patients who drink alcohol for long periods of time, timing is recommended to prevent Wernicke's or Korsakoff syndrome, and we spend time in ED to support those patients in receiving their medication, and also we help the journey of the patient. Sometimes those patients don't need to stay in the hospital as they don't have any other relevant medical conditions. They only come for a conversation, or they've been into some sort of a situation where they need support. And then we signpost them to community services, we provide them the support they need there, and then we discharge them home with a robust plan so they can support themselves and receive the help they need.
For the alcohol care team, there's no such thing as a typical person. We're a non-judgmental service that ensure that anyone can talk to us, even if that's for advice. We make sure that everybody feels that they have a voice, and we are here to ensure that staff, patients, colleagues all have that voice to combat stigma around substance use.
So I'm Tash, and I work for Somerset Drug and Alcohol team, and I am a young person's recovery worker, but I also do some youth work in the hospital at Musgrove. So we see a lot of people using drugs such as ketamine, cocaine, a lot of cannabis use, and we'll offer sort of interventions. We might signpost them to any sort of extra help that they need with mental health. and we'll offer weekly or fortnightly face-to-face support. So we're outreach, so we'll go and meet them or see them wherever they want us to see them. So I will go and see them while they're at school, and we've got a programme called Steps to Cope. So we'll put that into our sessions that we do with them, and obviously, that's something that I really enjoy, because I think it really does have an impact on helping them to cope with their parents using, or it might not even be their parents, it could be a brother or a sister or a grandparent. So yeah, our service gives them an opportunity to be able to talk openly about it, whereas they might not feel as safe to do that with other professionals. And I think it's just support just for them. Obviously, the parents, if they're getting support, they'd be getting that from our adult service or wherever else, but we're just there for them. So I think it's really important that they have that. Sometimes the parents do think, there's a stigma attached to drug use and alcohol use. And I think they are concerned that, if we come in, we're kind of, what are we going to talk about? What are we going to do? But yeah, we do work with the parents as well, and we'll sort of talk through with them, what our sessions will look like. So it's not all kind of, we're going in and just getting them to disclose loads of stuff. It's more just to make sure that they're supported, the children feel supported, and they've got someone to talk to with whatever worries that they have and how it's impacted them. If I feel like there's a young person that has a mental health need, we can put a referral into CAMHS just to get them that support for that. And also when I'm doing the youth work in the hospital, sometimes there might be a young person for me to see that is already with CAMHS. So we might do like a joint intervention with them here at the hospital. So we will link in with children's social care quite a bit, especially if the children that I'm working with are on a child protection plan or a child in need plan. We have lots of review meetings together, and just to keep everybody in the loop of what best way we can support the child. So I come in twice a week and I'll do some youth work. So I'll come into A&E and I'll just see if there's any young people that would like to chat to me. I'll sometimes come up to the children's ward. I also liaise with CAMHS that are here every day of the week. We'll just have a chat and see if they've got anybody that could use our service. It doesn't necessarily have to be drugs and alcohol related, because a conversation might lead to that, coming up. So yeah, it's just, and if it's not drug and alcohol related, I might be able to signpost them to the services that they need. So the best thing about working with young people is there's so many different characters, and I think, they're at that really important part of their life where they're sort of making choices. Sometimes they might not be the best ones, and sometimes they might just need the right support and guidance just to kind of make sure that they've got some tools and coping mechanisms to take on to their adult life. I think with the younger ones, with the hidden harm work that I do, I think, that is really important, just to have the child just has someone to talk to and to build trust with as well. I think sometimes it's quite difficult for them to know that it's okay to trust a professional. And then with some of the older ones that I work with who are actively using, I think again it's just the support and knowing that there's no judgment, there's no, because there's always kind of a stigma attached to drugs and alcohol, and I think by them using our service, they lose that a little bit, and they see that there doesn't have to be that stigma.
I think if you're thinking about making changes and you're unsure if you want to put the referral in or not, just go ahead and do it, because what we can do is you can speak to a member of the team, we can see what treatment really is and what treatment can offer you. And of course we work on a person-centred approach. It really does depend on the client's needs and that individual as to what we offer and how your treatment will look. So don't sort of listen to what you see on the news or what you might have heard, the preconceptions. Just come on in, speak to a member of the team. We can make a plan together. We can make a plan to get you where you want to be. Yeah, so just do it. I think if you're having those thoughts, just go for it.